Thanks very much, Jackie. Well, as we've been revealing this morning, the Royal College of Physicians has said that it recognises obesity as a disease, not a lifestyle choice, and it would like the government to follow suit. Well, we're here in a weight loss clinic in Newcastle, and I'm joined by the weight loss surgeon, Zaher Toumi. In terms of weight loss surgery, we're seeing people working out, changing their diet, getting psychological help. That is the other option, isn't it? Actually physically having surgery. What are the figures like in the UK compared to the rest of the world?
The number of bariatric operations in the UK is very small, and excluding Ireland, possibly relative to the size of the population in the UK, the number of operations is among the lowest in the Western world.
Why do you think that is?
In my opinion, the main cause for that is weight bias, which is in the UK is among the highest level of weight bias in the Western world. And because of this weight bias...
Well, sorry, what does weight bias mean?
It means people think about obese people as lazy people, as people who eat too much, exercise too little, without understanding the disease of obesity, and subsequently they discriminate against them in regards to access to healthcare, in regards to access to jobs, in regards to access to education. So this is what weight bias is
So if somebody is overweight and they go to their doctors, the likelihood of the doctor suggesting surgery is quite low, is it?
That's right, it's quite low. And initially, even if they offer them any treatment, the first line of treatment is normally dietary and lifestyle changes through what's called as a Tier 3 weight management service.
But of course, that is a cheap way to do it, isn't it? Asking people to eat less and exercise doesn't cost the NHS a great deal of money. These surgeries do, don't they? They're expensive.
So surgery, bariatric surgery costs money, but bariatric surgery is the most effective treatment for obesity. It's really the only treatment that is proven to achieve substantial and sustainable weight loss, both in the short term and also in the long term. In regards to cost effectiveness, bariatric surgery is known to be cost effective. A recent study from the National Institute for Health Research found bariatric surgery to be the most cost-effective treatment for obesity. In regards to the cost of surgery and the cost of treatment for people who are affected by obesity, if you compare people who had bariatric surgery to those who did not have bariatric surgery, in a study which was done by my colleagues in McGill University in Montreal, they found that the cost of those people who did not have surgery is 45% higher than the cost of people who had surgery, and that's within the first 5 years after the treatment.
So if the surgery costs, it's around £6,000, isn't it? The amount that they would have costed the NHS without that surgery will be greater, over the first 4 or 5 years.
Because many people who are affected by obesity are on many medications. Some of these medications have increased in price. Especially more effective medications are very expensive. And in addition to that, there is a cost in regards to unemployment, cost in regards to being immobile, needing other services, etc.
What about the risks, briefly?
The surgery is very much known to be safe, bariatric surgery. The risk of dying because of bariatric surgery in the UK is around the region of 1 in 1,000 patients. If you compare that to something like gallbladder surgery, 1 in 400 patients die because of gallbladder surgery. So it's a very safe surgery when it's done by skilled hands.
So, Toumi, good to talk to you. Thank you very much
for
coming down here today. We've got some very enthusiastic people working out behind us. We're going to be talking to some of them throughout the day here on Sky. But now let's hand you back to Naz with the weather.